for a ride, and we'll ride through the midnight. Don't you step across that line.
Welcome to the revival episode of the Trosscast. This is a podcast that from its early generation was one that I wanted to be able to grab patient questions, things that we were seeing commonalities on, and then to be able to speak to everybody through the podcast with that, so you can grab some information, see how we provide chiropractic care in the office here, and to also learn, okay, what do we do in different situations? Today's episode is brought to you by Lentini Productions. We're very thankful for them. We're just gonna get into a couple of things early today. So we threw out a question on our social media, and we're very thankful for the interactions on there and all the questions you guys shot on there. So we're gonna grab a couple of them and just kind of riff on them today. So the first question was pretty cool, just generics. What's going on at Tross right now? What do you got going on at Tross right now, Dr. Austin?
So kind of something that we talked a little bit about was just the things that we're seeing the most common of right now, right? So one of the biggest things right now, I mean, with the epidemic that we had, I feel like pickleball just blew up out of nowhere.
For sure.
I mean, Bed Bath & Beyond was bought out. Like, all these leagues are all over the place now. So basically we're seeing a bunch of like lateral epicondylitis, medial epicondylitis. So from that aspect of it, we're seeing people come in with like pain right at that elbow joint a little bit. And really that's because they go from 0 to 100 real quick. I mean, they go from not swinging a paddle ever, or since PE class in who knows when, to all of a sudden they're playing consistently all the time. I had a couple of patients who were like, yeah, I'm playing 3 to 4 times a week. That's awesome. I mean, getting great cardio, great work, but all of a sudden you're using muscles that you really haven't used in a little bit. So from that aspect of it, we're seeing a lot of like extensor use and a lot of flexor use that is just taking a lot of over performance that they didn't have to in a little bit.
For sure.
So we start to see, okay, where the muscles come in and pulls at their joint attachment right there, they're really starting to get that overuse mechanism because it's being asked to do something it hasn't been in a little bit. So from that aspect of it, what we do then is a lot of like soft tissue work, right? We come in, a lot of scraping, a lot of cupping, a lot of manual ART, where we're just kind of releasing the soft tissue.
Yeah.
Because at that point, if you can get the soft tissue to release, it takes that tension force off of where the tendon attaches into the bone there. And that's where you're getting a lot of the pain at that point, is the overuse at that aspect.
I kind of have my thoughts on
For
this.
sure.
Where else do you look at outside of that elbow?
Outside of
Putting the fire out, great.
Yep.
Where does your head go when you're saying, okay, now outside of that elbow, what do we need to be looking at for that patient?
I mean, a couple things from that aspect. I mean, you got to look at shoulder a little bit too, just because, I mean, you're using a lot of those external, internal rotations. So at that point, you want to make sure, okay, range of motion looks good there too.
Yeah.
You want to make sure you're not just using everything at the elbow because the shoulder doesn't have some of those ranges. So you need to look at outside of like the shoulder joint as well.
Yeah.
But strength too, man. I mean, those sorts of patients, yeah, we got to get things calmed down, but you got to make sure they have the strength at that point too, in order
100%.
In order to perform some of those movements at a higher level at that point. Because that's part of the issue, is you don't have the strength in order to do some of those, so that all of a sudden everything's having to work so much harder, and then you get that overpull in some of those areas.
That's a great point. I have that conversation with patients a lot. We have this overuse reaction, but then we have to think secondarily, okay, if we then strengthen you, can you handle that at that same rate and intensity without having that reaction?
Yep.
So that's always the cool conversation of getting away from putting the fire out to then, okay, how do we bulletproof that area and make sure that you can keep doing what you love? Because I know I hear you saying it, I say it. Our goal here is to keep people doing what they love. It's not to say, let's shut you down for 6 weeks. And of course it doesn't hurt when you're not doing it. That's what I think is a cool thing of like what I hear being talked about in the office here is, okay, what can we continue to do to make sure, all right, we put the fire out, but now we're going to strengthen. For me specifically, I go a lot to grip strength in those cases, and we are seeing a lot of it in the office right now.
Yep.
And as simple as like giving one of our logoed footballs and doing like, they call them putty exercises, but working on the grip portion of holding the paddle so then it can go through your supination, pronation movements. That is really big. And it's funny, we are seeing a lot of that right now. Getting into the chiropractic aspect of that. So I think there's a kind of a general thinking or understanding that chiropractic is just manipulation of the spine.
For sure.
Going on that line of thinking, what is the role of traditional spinal manipulation with that patient in your eyes?
In my eyes at that point, I mean, you got to look at thoracic spine too at that point, because it's a lot of twisting, it's a lot of motion at that point. So then if you don't have mobility there, in my eyes, if you don't have mobility in the thoracic spine, at that point you're really having to ask shoulder to do a whole lot more. You're really having to ask elbow to do a whole lot more. So thoracic spine for me is really important from a mobility aspect there.
Yeah. I get into this, and if you're getting to watch this on our video cast, you'll be able to see what I'm doing. But with any kind of rotational swinging, golfers, hitters, there is a huge spine component to it. And I go through it with my golfers is if I rotate to the left and then I were to come up, and if you're just listening to this, I've just rotated my head to the right after rotating my shoulders to the left. That is right rotation of the cervical spine. And so if we're limited in this motion when we go to swing, come across the body, if you're swinging a golf club, kind of getting into different sports here, that cervical spine limited range of motion can change how your body is going to rotate and then utilize everything. So as much as it is good to look at areas, the global approach of spine first really is a huge portion of what we do here too.
Yeah.
We are at the core of it, chiropractors. Manipulation is still our number one key.
Yep.
We have just liked to blend these other things in there because we saw the more tools you have in the tool bag to treat an individual, the better.
Yeah.
And the more that you get into these high level biomechanics, it brings us right back to our roots of spine first.
Yeah.
Would you agree?
Oh, for sure. And I think looking at it from that aspect, I mean, you can look at it as in college, you have majors and minors, right? Like our major is spinal manipulation. That is it is our core.
Love it.
But then we have minors in other areas where I would say one of our minor is biomechanics. One of our minor is soft tissue specialists.
For sure.
So then at that aspect of it, okay, yes, we're obviously looking at the spine, but there's so many other things that we can bring to the table at that point too.
Yeah. And to me, with those patients, again, I keep using the term putting the fire out, and that is like going to the area of the inflammatory response, the tendinitis, the tendinosis, the sprain, the strain. We obviously have to get that tissue desensitized. We have to decrease the inflammation there.
Yep.
But then it's the approach of looking long-term and not just slapping the Band-Aid on it.
Yep.
And that's where that's what gets me up in the morning to continue to come and do what we do. I love that portion of it. And not that we don't love putting the fires out, because we do that a lot too. And that looks, the acute injury athlete, like we kind of pride ourselves on, hey, come give us a shot to get you back on the field quick.
Yep.
But then it's that transition of thought of, let's take a little deeper look and to make sure that there wasn't a biomechanical issue that led to this. Sometimes it's just, I took a helmet to the knee, right? But other times it's this slow, repetitive biomechanical stress, and we want to hit that from the root cause.
Yep, for sure.
And that kind of leads us right into our next question, which it was a great question sent to us on Instagram, but the role of chiropractic care in injury prevention.
Yeah.
I think that is a great segue, and we've hit a couple of those points, but how would you say chiropractic adjustments, soft tissue therapies can help athletes maintain optimal performance, maybe after that fire is put out?
Yeah.
What's your line of thinking? What's your thought process there?
For sure. So specifically with some of those things, I mean, think of like a soccer player, right? They might come in originally with, hey, I got a little bit of knee pain, right? Cool. Put the fire out. That's what we need to do. But from a chiropractic aspect at that point too is, okay, what's your SI joint look like? What's glute med look like? How does stabilization look like at that point? And that is where the kind of some of that maintenance care, some of that performance care at that point of, okay, we got to make sure we're keeping the mobility, right? We got to make sure we're not all of a sudden over-stabilizing on one side versus the other, because that's sometimes when you can start to see some of those injuries come into play a little bit more. So it's keeping you on the field at that point. It's making sure, okay, again, not to sound repetitive, but from a stabilization standpoint, glutes are firing like they're supposed to. You don't have over-dominant of one side versus the other, because in soccer, you're cutting all the time. So that if all of a sudden you're asking one side to do a little bit more than it's used to or it needs to, that's when all of a sudden you see kind of injury creep in a little bit. Mm-hmm. So it's taking care of those things at the root cause and then making sure it doesn't then translate down into a knee injury at that point.
Great. I have a couple of sayings that I go to answer this question, but, excuse me, an athlete that moves better performs better off the bat. And that movement is happening consistently no matter what sport you're playing. You're doing that sport a couple of times a week in practice, a couple of times in like high-level game-like situations. And then typically for most of these individuals, they're going home and doing it at home too. My daughter, she's dribbling around the house. The amount of movement that you do in between those injuries is really the areas where I love to see an athlete. So we can get baselines on where they're at physically, but then also so that we can continue to bring the body back down to a good baseline, knowing the areas of stability, mobility, looking at them from this joint by joint approach. And then we get to have the conversation of everybody has a capacity, and then we can handle so much load. When the load exceeds that capacity, I like to use a cup. If you had a 12-ounce cup and you just continued to pour water into it, eventually that water is going to overflow. The overflow point is when we see athletes in here from an acute standpoint, from an injury standpoint. That's when they have the itises, the osises, the tendinosises, the sprain strains. My area where I like to get to that athlete is before that load hits the capacity. And again, I speak with my hands a lot. If you're watching this on videocast, you'll get this. If you're just listening to it, stay with my cup analogy, where the prevention treatment in chiropractic care decreases our load. So that water stays below the brim of the cup. And that way they can continue to optimize and strengthen without having the inflammatory response, the stress in the body. That's where I feel like chiropractic care from an overall general standpoint is amazing in the prevention side. Decreasing the load and stress that the body takes in all of these areas to make sure that we're not hitting our capacity. Now, I think you hit on it in the first point is then, okay, how do we increase the capacity? How do we take that 12-ounce cup and make it a 24-ounce cup? That is the specified exercises. That's the getting into the stability. Let's make sure that we have some semblance of symmetry. That's where it becomes even cooler, is now you can increase your capacity and decrease your load, which makes for optimization. That's where every person, we talk about athletes a lot here, but the majority of our patients,
the weekend warriors,
are just like you and I, where they love to stay moving, but we're not being paid to do anything. We just do things to keep our bodies healthy and have fun and enjoy life. And we deserve that same thing,
for sure.
And that's where, for me, chiropractic care in injury prevention really kind of, that makes its money, if you will.
Well, and I think your boy Tom Brady hits it on the head with the word pliability.
Yeah, we got to bring up Brady.
Just from a pliability aspect, I mean, you need that muscle to be strong, but you also need it to withstand some stress at the same time. And I think for us, from putting out the fire standpoint, but then making sure they stay pliable too. And I think that's something that
100%.
we pride ourselves on too, is making sure, okay, yes, we're getting the joints moving, we're doing our chiropractic duties, right? But we're also making sure that soft tissue stays pliable too, through techniques like active release technique, through techniques like Graston, but making sure the muscles have that pliability component to it as well.
Yeah. Yes. And that's a great, I think, segue for us too, is we have tools here in the tool bag that are utilized in the acute processes of, again, getting the fire put out. Stay with my analogy there. I hate to be redundant, but it makes sense of, let's get that tissue in a normalized state. Again, desensitize the tissue, decrease the inflammation. What do you like in the acute phases from your tools in the tool bag? Or what do you feel like is your go-tos for an acute injury?
Yeah.
Give an example, and then like, what do you utilize as a practitioner?
For sure. So say somebody comes in shoulder injury, right? Just did it the other day, they were throwing, all of a sudden they're getting super sore, right? So kind of something that I look at right off the bat is, okay, we need to get as much blood flow to that soft tissue as we possibly can.
Yep.
Okay.
Great point.
Because that's optimal for recovery at that point. So I'm looking at that point at, okay, I'm probably going to do some Graston scraping, right? Because Graston scraping is great from a couple different components, but one of the main reasons is it's bringing blood flow to that tissue, right? Yep. We're going in, we're kind of hitting the muscle fibers themselves and shunting blood flow to the area, okay? That's number one. I'm probably looking at a little bit of Graston scraping, but number two, I'm probably going to be doing some cupping on them too, because, I mean, one of the things I tell people is, think of Michael Phelps when he was in his, like, going for his golds. All of a sudden you saw all those like octopus marks on him, right? All those circles. Well, for him, he needs crazy recovery, right? Because he's in so many different races that his muscles don't have time to recover. As if he was racing once and then 2 weeks later. No, he's doing 7 different races in a matter of a couple days.
Yep.
So for him, he had the cupping done because he needs recovery, right? So it's the same thing. Somebody comes in with a shoulder injury, we've got to get that blood flow to the area for recovery.
Yep.
So we're probably throwing some cups on him. I'm going to be doing some of the active release technique. Now, depending on degree of injury, right? Kind of depends on how aggressive we go with it too.
For sure.
If something's already super inflamed, I'm not going in and going super heavy right off the bat, because you're just going to make it even more inflamed.
Right.
Now, there's pros and cons to that.
Yeah.
But probably not so aggressive right off the bat, but we do need to work on starting to get that blood flow, getting that recovery process started. The other thing that we have in our toolbox too is dry needling, right? From a little bit deeper penetration level, you are getting the needles in the soft tissue. You're getting that deeper reaction of, okay, all of a sudden you got that brain-body connection of something's going on in that area. We need to start the healing process. Well, start the healing process. Again, you got blood flow going there. You got the nutrients going there. You got everything going to that area. So it really amplifies that recovery process a little bit.
And I know that was a loaded question, because
For sure.
I know how specified we treat.
Yep.
And it's like, okay, not every acute injury is treated the same.
Yep.
And that was a great answer, because it really is like, for me, hearing you say that, it's like, it depends on what's coming in, what tool we're going to use, how aggressive we're going to use that tool. But it's nice that outside of the manipulation, there's these tools that we have that can really help patients get to that healing and recovery.
And again, going back to what we said, we're chiropractors at heart, right?
Yeah.
So obviously you're going to look at, okay, what does thoracic spine mobility look like? What does neck mobility look like? Because that's our basis. You got to look there in order to get the recovery in other places too.
For sure.
But from a pinpoint specific standpoint, that's kind of what I'm looking at from a soft tissue standpoint.
Did I tell you with your Michael Phelps analogy there? I've definitely dated myself. We've had some younger athletes come in here, and I try to use Michael Phelps.
They don't know who he is.
They don't know who he is. And I'm like, yeah, I'm getting old, man. I'm the old guy with the gray beard now.
I don't even know who they would know.
So now I got to start getting some new examples. I can't pull out like Dion and
yeah. Now you got to do Shador though.
Mark McGuire.
Yeah.
Like, who's this guy talking about?
Mason Wynn. You got to talk at their level.
Another great question we got, and this will probably be the final one for wrapping up here today, but if and when do we collaborate with other healthcare professionals? And I think that's a really good point to talk on because I feel like a lot of people are like, if you go to the chiropractor, then you're kind of outside of this other model. And that isn't true here. No. And we have a lot of different healthcare professionals, and I consider healthcare professionals to be a very wide range of individuals that we refer to. Just to kind of help like prep what I want to hear, but is, to me, we have, chiropractic care that we use, other chiropractic professionals. Other chiropractic professionals refer here. We've got, and that is sometimes even in the chiropractic profession, we have these knowledge bases and these emphases where we've spent our time in post-grad, but there might be an area that is still a chiropractic case that we refer out to. So that's one. But then outside of the chiropractic world, what other healthcare providers do you see yourself utilizing? And then, in what cases or when do you utilize them?
Yeah, for sure. So, I mean, hit the point one. I'm looking at PTs, looking at physical therapists, trainers, right? We work really closely with Emerge Fitness. So, and even just trainers at school too. I mean, I know we got some pretty good relationships with a couple of different schools, trainers around here. MDs, nutritionists, I think those are some really good places to start. Because one saying that I really like is you wouldn't put like the cheapest fuel in a Maserati, right? So at that point, if they're eating like garbage and their recovery is garbage, you got to look at what you're putting in your body at that point, right? So nutritionists is huge. PTs. I mean, what we like to, again, pride ourselves on is we're really good at getting things moving, right? We're really good at making sure mobility and function is there. But something that we talk about a lot is they also need stability, and they also need to be able to keep that biomechanical performance once we get it to that point, right? So from a physical therapy standpoint, that's when you can really bring them in and say, hey, listen, we've got things moving really well here. They really need to focus on stability. They really need to focus on exercises. And that's their world, man. So, I mean, between exercises of trainers, specific exercises that PTs are going to do with them, if you can bring all of that in together, I mean, I feel like you're only doing a better service for the patient at that point.
For sure. And we have, it's something we talked a lot about when you were interning here, and then obviously in the early years of you being a full-time doc here, is like, leave the ego at the door. Obviously, we know when and where we excel. And there are times where you have to get that patient in the hands of somebody else that excels in the area that they need. And when you leave that ego at the door, for us, that is when the referral process is key. Because it's always, where does that patient need to be? And it's always patient first. So for us, and that looks different on referrals from my side of things, is do we not like something we're seeing in the orthopedic testing? Do we not like something we're seeing with how they're responding to care? We have, do we think this is a level up? Do we need to get them in the hands of the orthopedist? And we have a great referral partner with Advanced Bone and Joint. And it depends on what area of the body. We have relationships with high-level docs over there that then specify in their own areas. And so that is a great referral source for us. We utilize Axis Physical Therapy. Sure, great. That seems to be our first go-tos. Again, sometimes that patient needs a longer duration of time of focused exercise therapy. Our model doesn't fit that. And by model, I mean how the insurance and how the worlds have been set up. Their model and their knowledge fits that. And that's a referral source. We have Emerge. You talked about Emerge.
Yeah.
Just phenomenal personal trainers over there. And with a knowledge base of getting them into that active routine of loading the muscle, of getting hypertrophy training. Like, again, our model doesn't set up well for that. And we can utilize their brains and have this great referral set up to make sure that, again, that patient is getting what they need. All of these things for us, and it was a wonderful question. I think, thank you for sending it to us. That is times two is like young athletes. I think parents are like, oh, we need to go to orthopedic first. Sometimes you do. Sometimes that's not the right call. Same thing as I would tell people is sometimes chiropractic isn't the right call first. But having a team around us, we want our patients to feel solid that we're making the best decisions for them at the right time. And when we tell a patient like, no, you're still in the right spot, we just need a little more time, or no, we got to hit the stop button here and we got to get you to somebody else. We pride ourselves of having a very good knowledge base of when to, and we are very happy to utilize those referral partners. And that's for us, is having this blended multidisciplinary care is one area where I feel like patients have gotten better is when we utilize our referral partners at the right time correctly. And we get other individuals that are brilliant and specialize in their area. And it's something that we utilize quite a bit here. And it's been beneficial for us as practitioners, but also, again, at that patient first mindset. So we appreciate you guys tuning back into the Revival podcast today. Of the Tross cast. We hope you guys had a great time listening to this. If you have questions, we will keep putting the opportunity to post them. We'd love to hear what you want to hear. And that way we can keep hitting topics from our point of view, maybe stir some conversation and some thoughts on your end. And then obviously, if you need anything else, don't hesitate to reach out to us. It's what we're here for, is to make sure we're giving as much information outside of our treatment as well that you guys need, just to make sure you can live happier lives, move better, do what you want, so you can unlock that elite athlete in you. Again, thank you to Lentini Productions for sponsoring our podcast today. They do amazing work. And if you've seen our social media lately, all the really awesome looking stuff is them. So they've helped us in so many areas. And so if you guys are needing any of those services, make sure you reach out to them. Again, thank you so much for listening in today, and we hope you guys got something from it. Thank you.